Hello, so today in this video we are going to be talking about how many carbohydrates a pregnant woman needs. Well, these videos are meant to give you an overview of what a balanced diet should look like, but I do not recommend that you start counting your carbohydrates, your proteins, your fats in your everyday diet. So here is an overview. Look, a non-pregnant woman requires somewhere around 120 to 130 grams of carbohydrates per day in her diet, and a pregnant patient requires somewhere around 170 to 175 grams of carbohydrates in her diet. But these are generalizations because it also depends on the total caloric intake that you have put yourself on. By and large, you should get around 50 to 60% of your calories from carbohydrates when you're pregnant. Because there are a lot of diets going on these days, and there is a keto diet which says you are on less than 25 grams a day, and then there is a low carb diet which says you should be on less than 50 grams a day. But in pregnancy we do not advocate that you are on any kind of specialized diet. So that is why this is for general non-obese people, that this is the recommendations at the moment by our medical associations, and that's what you should target achieving. For example, one chapati that you are having approximately has 11 grams of carbohydrates, whereas 100 grams of cooked rice has around 28 grams of carbohydrates. But it is very important about what carbohydrates you are having. It is recommended that you do not have processed carbohydrates because they can fluctuate your blood sugars quite a lot. On the other hand, if you get carbohydrates from, say, fruits or from vegetables, and especially fiber is also a type of carbohydrates, you should aim to have a lot of carbohydrates. Approximately 30 to 40 grams of fiber every day is recommended, because constipation is a very common problem in pregnancy. So, and also if you have enough water intake and good amount of fiber, this fiber you can take from whole grains, you can take whole fruit, you can take nuts, all those, and of course isabgol, and all those are very high sources of fiber. They can keep your blood sugar levels in place. They will also help you reduce your cholesterol levels. They will also reduce your tendency for high blood pressure later on in pregnancy. So if you are a high risk person, you are obese, you should have more fiber in your diet. Avoid processed carbohydrates because we don't want any blood sugar fluctuations happening too much in pregnancy. And avoid juices, have whole fruit. If your teeth are okay, stop having juices. Please have whole fruits, because that way you will have less wastage and you will have more fiber in your diet, which will help you to control all those problems. So in case you are on weight restriction, you're watching your weight, you're on carb restriction, fibers are a very, very good source to be included in your diet. And if you essentially have been told by your doctor to not increase your weight too much, you should just write down all those food stuff that you are having in your diet, take it to a dietitian and see what all improvements you can do in your diet. Well, that's all for today. We will be bringing up more videos on relative subjects. Watch out this space. Bye-bye.